Good morning, everyone. Thank you. I'll just get straight into it. So, in this presentation, I'll just give a brief overview of the project and then discuss the background, method, and some preliminary results. This study is part of a larger study where we've interviewed GPs, midwives, health visitors, and stop smoking advisors. But in this talk, I'm just going to be presenting some data from the midwives and health visitors. So in the UK, the prevalence of smoking is around 10% in pregnancy. In some regions, it's as high as 28%. And so it's a public health priority to find effective ways to help pregnant women quit smoking. And the government has set the target to reduce this to 6% or less by 2022. Traditionally, nicotine replacement therapy is given in pregnancy to help pregnant women quit smoking, but studies have found that it's relatively ineffective in pregnancy. There's low compliance rates, and it's been found to be no more effective than placebo. So new treatment options are needed, and since electronic cigarettes are now the most popular method of quitting smoking in the UK, it's thought that they could play a potential role in helping pregnant women quit smoking. But first of all, we need to find out what health professionals think about these devices, as they're the ones that are likely to be offering support during pregnancy. So with that in mind, our aim was to use qualitative methods to explore healthcare professionals' attitudes and knowledge towards the use of e-cigarettes in pregnancy, including exploring their beliefs about health risks, how they compare to cigarettes, their perspectives on promoting and advocating e-cigarettes, and also identifying any training needs. So our recruitment was via the team's professional contacts and then utilising a snowball technique. We advertised the study on Twitter and our website as well, and we've had people from across the country take part in one telephone interview. So we've had 28 midwives and health visitors, and the data has been analysed using a framework approach. So these tables just give you an example of the participants' backgrounds. They ranged in age from 24 to 59 years old, with varying years of experience, so some relatively new to the profession, with some with many years almost approaching retirement age. Some of them were ex-smokers and ex-vapers, with 2 current smokers and 1 current vapor. So the analysis is still ongoing, so I'm going to present some preliminary results today, which centre around these key themes. So onto attitudes and beliefs towards e-cigarettes. The different attitudes lay on a continuum, so we did have some people that were very positive about e-cigarette use in pregnancy, and then those that were very negative about the use, and a few people in between that kind of ambivalent or didn't really have one thought either way. So just to give you some examples of a negative attitude, some people felt that vaping can be worse for you than smoking, particularly in certain conditions. But often this was just kind of what they'd heard in the media or news. It wasn't really based on any particular evidence. Those that had positive attitudes recognised that since there's far fewer chemicals in an e-cigarette, then by default they must be much safer to use. And then people, some were a bit more cautious in their attitudes. They recognised that they could potentially help people quit smoking, but they're not risk-free. And if someone is using an e-cigarette, then they should aim to quit the e-cigarette as soon as possible. So knowledge was another key theme. There was a clear lack of knowledge and awareness about e-cigarettes and policies. Many people felt that there wasn't information available for staff. The majority of them didn't go actively seeking information about e-cigarettes. A lot of them did have concerns about secondhand vape or concerns about the safety of nicotine. but then they didn't have any concerns about recommending nicotine replacement therapy. So the lack of knowledge often led to uncertainty over what they should be saying about e-cigarettes. So sometimes they would state something that's incorrect. A lot of people said that they weren't sure, or they didn't know what they should be saying about them. And there was a fear that they might potentially say the wrong thing. And then also this led to confusion as well. People reported hearing different things from colleagues or from friends and family or from what's in the media. And this led to confusion amongst staff. And therefore patients are likely to be receiving mixed messages from the different health professionals that they see. Skills and training was another theme. So there was wide variation in the amount of training that people had received on smoking cessation. Some staff had annual training, others hadn't had any training since they had qualified as a student. And those that had training on smoking cessation, it usually focused on the risks of smoking rather than the different treatment options or how to support a patient. And very, very few had any training on e-cigarettes. There were a couple of midwives whose role was to provide smoking cessation support to staff, and they had received training from NCSCT, but I think there was only 2 of those people. So where their role was focused on smoking cessation, they had training, but the majority of them didn't have any training on smoking cessation. The majority did indicate that they would benefit from further training, particularly on e-cigarettes, as they become more and more popular. And they're getting asked more and more about e-cigarettes from the patients that they see. So professional role and identity was another key theme. Within this theme, all staff reported assessing smoking behaviour and referring on to more specialist support, but the majority felt that their role ended there, so there would be no more discussions throughout the pregnancy about smoking cessation. Some of them were a bit scared. If they were to bring it up, it would be like preaching, and particularly in pregnancy there's a lot of things and concerns that they didn't think smoking was a priority. It was seen as someone else's responsibility to do that, such as the consultant or stop smoking advisors. There was also a lack of confidence and self-efficacy in their ability to appropriately talk about e-cigarettes. Many of them didn't feel very comfortable, so they would rather stick to discussing familiar products such as NRT. And some people felt that there was a lot of scaremongering about e-cigarettes, and it was difficult for them to know what's true and what's not. So they wouldn't bring up the topic, or they would steer the patient towards considering NRT instead. The environmental context is also important to take into account to explain barriers to e-cigarette conversations. So, for example, some people reported being restricted by policies at work. In this particular instance, they were told that they shouldn't be recommending e-cigarettes. And people felt there was a lack of guidance at work over what they could be saying. I'll just quickly skip through. Information was not filtering through to the staff. We know there's a lot of information available out there, but it's not getting through to the staff. Lack of time as well. There's time pressures to discuss, limited time to discuss things with the patients. And there's still a stigma, so vaping and smoking are sometimes still seen as the same thing among staff as well. So to conclude then, we know there are guidelines and policies and evidence, but they're not reaching, it's frozen. There are guidelines available, but they're not reaching the staff. And this is leading to confusion. Patients might be receiving mixed messages. All staff would welcome further training, but it's not yet known the optimal way of delivering this training, which is the next area of research for us. And I'd just like to thank the team and Cancer Research UK for the funding.